Hi there, welcome to Integrated Clinical Strength and Conditioning. My name is Uzo Ehiog. In this short video, what I'm going to do is I'm going to provide you essentially with an overview of some of the books that I think are really good books for early career practitioners in physiotherapy to get to grips with, really to make sense of one, their own physiotherapy practice, but also strength and conditioning and also rehabilitation and how to integrate all of that together. So obviously, I've been qualified for nearly 20 years or so, and over that period of time, certainly, I mean, I've read loads of things, loads of papers, loads of books, and what I'm going to do, I'm going to give you an overview of what I think are probably about 5 or 6 books that I think would really stand you in good stead for numerous reasons. Okay, I must say from the outset as well. Okay, any books that I'm endorsing here. Okay, I don't get any royalties or any commission or anything like that. Okay, from Amazon. Okay, or any other organisation for that matter. These are really just books that I think are really good for early career practitioners. So the first one. So the first one is this one here, okay, and this one is written by Petty and Moore, okay, and essentially it's the examination of the neuromusculoskeletal system. Why is it such a good book? Well, often what people will ask me, okay, they will say, okay, you know, I'm really interested in S&C, I'm really interested in rehab. Is there an S&C book you think I need, or is there an S&C course you think I should do? Well, actually, I think we've got to take a step back, and what I think is really important is the important thing to understand about strength and conditioning, okay, as it applies to rehabilitation and such like, is this: you still have to be a damn good physiotherapist first, okay? The S&C stuff, okay, and the rehab stuff is what comes after you've established what the diagnosis is. Okay, or you've established what the patient's underlying problems are. The difficulty is if you go straight to S&C or you go straight to rehab, everything looks like and ends with an exercise solution. Okay, but the good thing about this book is essentially what it does is it takes you through diagnostically the steps, okay, that you need to go through in order, okay, to come up with an appropriate physiotherapy diagnosis, quote unquote, for want of a better phrase. Okay, it's absolutely a brilliant book. Okay, it's not old. It's not new. It won't cost you very much. Okay, and essentially it's full of pictures. It's full of essentially diagnostic reasoning. Yeah, so it's really good at getting you around. Okay, taking a subjective history or a history, for want of a better phrase, but also it goes into the diagnostic in a lot of detail. So that's my first one. The next one, okay, is really around philosophy, okay, but broadly speaking, it's this one, okay. It's called The Little Black Book, okay, of Training Wisdom, okay, written by Dan Clever. Okay, this is an excellent book. Now, in this book, what you will not find is you will not find sets and reps in this book. This is not what this book's about at all. What this book's about, fundamentally, okay, is the philosophy, okay, right, and the broader issues around, okay, exercise prescription and training, okay. If you can get your head around this book, and it's not a very long book, okay, it's a very easy read, but what Dan has done expertly, yeah, is he's taken away all the faff, okay, he's taken away all of the detailed explanations, okay, around various concepts, okay, in strength and conditioning and training predominantly, okay, and he's basically, okay, condensed it down into the bare basics. So this is a really good book, okay, it doesn't take long to read, but it gives you a very good overview, okay, of essentially training theory, which fundamentally is rehabilitation. Yeah, it's just a different name. But this is an absolutely amazing book and well worth it. Okay, very, very inexpensive on Amazon currently. Okay, number 3. So number 3, okay, is written by Donald Newman, okay, and it's the Kinesiology of the Musculoskeletal System, okay, Foundations for Practice. Now, this is one of my first books that I actually ever bought as a student, and this is at least, I don't know, 15 years, 16 years old, something like that. It is brilliant. The reason why it's brilliant is because this is the best book you will get that runs through functional biomechanics as it relates to clinical practice and has a whole host of pictures within it. And this is great because really, look guys, okay, biomechanics is fundamental to what we do in practice. Yes, of course, communication skills are fundamentally important as well. But essentially, as a physical therapist or physiotherapist, what underpins what you do is anatomy, physiology, biomechanics, communication skills, and psychology. So you got to do this. So you got to do this other stuff. The reason why I like this book so much, again, full of pictures. Okay, full of pictures. Okay, and what it does is it explains. Okay, it explains quite comprehensively, okay, taking a joint by joint approach, okay, all of the key fundamental biomechanics, okay, that underpins your practice as a physiotherapist. This is written for physiotherapists. So this book is absolutely critical and it's brilliant. It's one of my go-to books, okay, when I'm struggling around some concepts. It's great. It covers anatomy, it covers applied anatomy, it covers biomechanics, okay, and it covers a little bit of physiology, but really it's a biomechanical textbook. So that's number 3. Okay, number four takes us into, okay, this is called athletic movement skills. Now, this one is written by Clive Brewer, and I came across this one actually by chance. So I was in the first year of my MSc in strength and conditioning, and essentially I was struggling really, okay, I was struggling with effectively some of the practical aspects and components, and I came across this book, and it was essentially, the recommendations on Amazon were second to none. Now this is a really good book. The reason why it's so good is because it goes through, essentially in a very practical way, okay, many of the strength and conditioning concepts, okay, that can be applied to rehabilitation. So it will go through, as an example, it goes through agility, it goes through jumping and landing, it goes through strength training, it goes through proprioception, it goes through movement competency. And again, very easy to read, loads of pictures, okay. What Clive has done is he's done a very good job, okay, of, again, distilling down complicated concepts into very manageable chunks. So this is a really good book, and again, this is very, very, very well priced indeed. So I can't recommend this book enough, okay. Worthwhile having this on your shelf, okay. Loads of practical application for rehabilitation, and actually Clive has done a really good job, okay. Right at the back of the book, okay, there's a chapter that essentially pulls all the other chapters together with 3 or 4 case studies. So this is definitely one to get. Okay, so number 5 is all about skill acquisition. Okay, and this one's a favourite of mine. This is actually a recent buy. Okay, and this is by Nick Winkelman. Okay, it's called The Language of Coaching. And again, you'll probably get the message. I like books that have pictures in them. Okay, if it's just dense text, okay, I struggle, okay, as a dyslexic to try and keep up. So, but this is really good, and the reason why it's good is because, okay, we know that language is important. Okay, we've known for years that what we say to patients can quite profoundly influence, okay, what they do, okay, and what they think about, okay, their particular presentation. So this essentially, okay, looks at it from a slightly different perspective. It looks at, okay, our use of language, okay, to aid skill acquisition, learning, and the retention of skill, which, come on, you'll admit, as a physical therapist, okay, this should be essentially top of our bookshelf. So again, full of pictures, okay, it is brilliant, okay, loads and loads and loads of pictures, okay. This is a really good book, okay. It's got loads of diagrams, loads of pictures, loads of metaphors, and this is a really good book, okay, for you to get your head around, okay, and certainly to have on your bookshelf, okay, to pull out when needed, okay, as a reference text, okay, in order, okay, to improve skill acquisition. Okay, this is a really good one. Okay, finally, something I think that brings it all together, okay, and this one is by Mark Jones and David Rivet, okay, and this is the most recent edition of Clinical Reasoning in Musculoskeletal Practice. And again, what this does, okay, this is clinical reasoning, okay, this is probably the best clinical reasoning book, okay, in physical therapy. This is their second edition. The first edition is also very good, which I have, okay, but this is their most recent edition. So obviously this is packed full of the most contemporary research, but also it's quite practical as well, in that what you get is you get the first 3 sections is based upon the theory that underpins clinical reasoning, diagnostic reasoning, pain sciences, psychosocial and narrative reasoning, and then it goes into numerous case studies that have been submitted by other physiotherapists around the world. And the good thing about it is well, when you read the case studies, okay, it's not about they're better than you, okay, and or you're better than them. It's not about that at all. What you really want to do is you're following their train of thinking, okay, and you should be thinking to yourself, okay, and at this stage, what would I be thinking? What would I be doing? And this is the reason why this is such a good book. So this pulls everything together, pretty much. Okay, so I'm going to stop here. Hopefully what I've done there is I've given you a flavour, okay, of some of the books that I think are quite useful and also quite fundamental for your practice, yeah? There are loads of things that you can read. There are loads of books on the market. Okay, all I've done here is I've given you a snapshot of some of the books that I think are very good, that I keep on my bookshelf, and that have been quite influential for my practice as a musculoskeletal rehabilitation therapist that has a special interest in strength and conditioning. So you heard it here first. They're the books, okay, that I would recommend. And you know, please feel free to share this video. Please feel free to comment as well. Join our community, okay. Follow us, okay. Log on to our website. We're on Twitter, and all of that good stuff. Thanks for listening. Bye for now.